Hello everyone, I am Prachi Tripathi, a student at IISER Bangalore, and today we have with us Dr. Prosenjit Mondal from IISER Berhampur. A warm welcome, sir. Welcome to Treat DM 2026. And so your research explores the molecular events that drive diseases. Can you shed some light on how understanding these cellular changes can lead to better strategies for preventing or treating diabetes and age-related disorders?
Yeah, thanks for having me here. So, as you mentioned that we, our lab, we are working on the metabolic disorder, mainly the non-alcoholic fatty liver disease and type 2 diabetes. So both these metabolic disease is significantly prevalence rate is really high in India and Southern Asia continent. But the interesting aspect is, although we have most number of type 2 diabetic patient and the fatty liver patient, but the data that we are having in current generation, whether from the genetic data or other, most of the data is coming from European population. So those information is not exactly predicting the pathophysiology of the development as well as the progression of the disease. And that also create a problem for the clinician to find out the cure for the disease. So what in our lab we try to find it out. We try to find it out if we can find out the causal factors which ultimately responsible for the development of type 2 diabetes in Indian population. As there are a number of information are currently available, we have some congenital defect in the pancreatic beta cell is in the function. So beta cell dysfunction is very much associated with the Indian population. We know that our stature is really small, our lean mass is less. So in this context, we try to find out exactly the pathophysiology behind the type 2 diabetes, as well as our food is, most of the time we have carbohydrate intake. So does our food has anything to do with the development of the fatty liver pathophysiology? So we're trying to work on both mice model as well as the clinical sample and try to find out if we can find out the reason behind this enormous number of the metabolic disease population or the burden in Indian subcontinent.
That was insightful. And now, following up on that, oxidative stress and metabolic imbalances are often linked to both diabetes and aging. So, what is one recent development that in this field that excites you the most?
Okay. So come back to this. I think this is a good question. I think we should all work on this direction. So I know the aging, this metabolic stress that you mentioned, and the development of metabolic disease. It's almost certain timings go hand in hand. So what we are trying to find out in this context, I can mention, if you consider aging or the metabolic disease is not particularly one organ specific or not a one protein or not a one gene is responsible. So what we're trying to find out the question in our lab. So now in this current era, the intra-organ crosstalk, like how one organ is interacting with the other organ, and ultimately this lead to the metabolic disease or in the aging. So this intra-organ crosstalk in the context of this development and progression of the disease as well as the aging factors, if you can put forward together, I think this last couple of years, a number of research findings have come into picture that how the intra-organ crosstalk play an important role and how intra-organ crosstalk ultimately leads to the development of metabolic disease and whether those intra-organ crosstalk are altered with the age progression. So that can be an interesting aspect that people should study, but it's better to study if we can study in the Indian context. So we'll have a specific solution as well as beneficial for the clinician aspect.
Yeah, that's actually interesting perspective. So now I would like to ask that what's your take on the time gap that is taken from by the basic science researchers to actually reach the clinic? So what steps would you suggest that can be taken to bridge the gap between the laboratory discoveries and the real world healthcare?
Yeah, I think this is really a pertinent question that all clinician and the basic scientists who are working in India across the world, they should come together. But if you consider even in the outside world, still they have some interaction. But thanks to this kind of conference, RISE meeting that Trade DM is happening. So there we get a chance to interact with the basic scientists and clinicians, sit together, interacting with them, they mentioned about the discovery. So until and unless basic scientists or basic discovery and the clinician talk to each other is very difficult. I think this kind of meeting, we need more meeting where the basic scientists and clinical should participate. They interact and they try to find out their discovery so that the discovery that work in the workbench that can be go to the patient. But I'm hopeful that eventually things are growing in India, in India academics. It will definitely has a long way to go, but I'm optimistic that in next couple of years we'll have lots of interesting findings that will go reach out to the patient or maybe the clinician. I'm keeping my finger crossed that in next 4 or 5 years it will be maybe the change will happen drastically.
So, thank you, sir. It was interesting to talk to you, and thank you for your valuable time and insights.
Thank you.
Thank you.
Thanks.